So very good evening, friends. Meeting again in the session of Materia Medica. And we're going to learn very important remedy. In fact, everyone knows that remedy, but still we know only few aspects about the remedy. That is the Platinum Metallicum, in short, platinum. We're going to learn it from the Allen's notes, but basically I want to tell you few important things about platinum. What we learn in our Materia Medica curriculum, that platina, superiority complex, haughty. Yes, definitely. These are the basic points with platina is there. But platina is a very important heavy metal having a big value. And this platina reflects in deeper pathologies. It is a very important remedy from the syphilitic miasm and for syphilitic pathology. I'm going to share one case. When I was learning, in fact, I was an intern during that time, but I was working with Bagli Hospital. And one of the patient who was admitted over there, he settled over there and he becomes my good friend. He was elder than me, about 10 years, but he was my good friend at that time. He asked me, sir, can you treat my mother? She's having some problems with both lower extremities, and she's unable to come over here in this hospital. And even though she walks inside the house, but still she expects that you must come over there. And it is there since last 2 years. She is not going outside anywhere. She used to remain in the house. And we are so much troubled because many investigations have been done, but no one was coming to the conclusion that what she is exactly having. People are saying that this is a paralysis, pre-paralytic state, paralysis, which is there because of which she is having the tremendous weakness in lower extremities. And she is the lady who is a dominating lady in our house. Everyone, whatever we used to follow is whatever order she gives. And everyone in house listens to her. So she is expecting that you should come in our house for treating her. So I agreed, okay, I will come over there and we'll see. It
So
was
your
close.
voice is not clear, sir.
Hello. Now is it clear?
Yes, sir.
Hmm. So I went over there to treat that patient. This fellow who welcomed me to their house, but as soon as I entered in her room, she looked in such a manner that I never forget that. It was a look that this fellow who will going to treat me. That was an aspect looking towards me that was very, very important. That's what I observed in her case. First and on entry point. And she was a lady nearly about 70 years around age, but in 70 years of age, when I visited over there at 8 o'clock at the night, and she was wearing a silk sari over there and lying in bed and absolutely well dressed, well behaved, everything that. And looking at her, she was looking to be a noble lady, but looks were very dominating. And she directly asked me, Doctor, are you going to treat me? I said, yes. Do you know what I am having? I, I told her that whatever your son has told, that's what I know, but I want to check up. Then she again looked towards me with arrogant eyes. And then I was talking to her, and whole story was that she was showing that how she is too important in everything, and she has developed this. since 2 years, this paralysis, which was gradually increasing, and now she was not able to go out since last 6 months, and she was remaining in the house, and she was not able to walk fast and everything. And she was quite irritable with her daughter-in-law. Then she ordered her, you please bring the tea for doctor, etc. All orders. She was giving the orders over there. The typical picture of Latina was there. The pride was there. The superiority complex was there. Thinks she is very tall and she is superior. Everything of Latina was there. But pathology was deeper. When I saw her EMG nerve conduction study, it was showing that she was having progressive neuropathy, muscular neuropathy. And she was having a weakness in the muscles of lower extremity, which was increased in last 2 years. And the EMG and nerve conduction study was done in just 1 month prior to it, and which was showing typical weakness over there in muscles of lower limbs. Question was that this is a pathological case, whether our remedy will going to work or not. I was very much neophyte, in fact, not yet completed the BHMS. Internship was going on, and I was called for treating such a difficult case. So what to do? Knowing that she was looking very clearly the platina, indications were there. The symptoms were gradually increasing over the period of time. It was not within a day. The paralysis had developed. It took nearly about 2 years to develop. But it was increasing. It was progressing. And still, at this age, at the age of 70, she was showing her arrogancy, her superiority, her pride, her dictatorialness, everything with everyone in the family members, over the family members. And second important thing, that the behavior and the looks were very typical of contemptuous, considering that she knows everything, other neighbors. So I was very much confirmed about platinum. Only thing was there in my mind, how to go ahead, whether to start with low or whether to start with high potency. Then I worked out the case. I repertorized at that time with Kent's repertory. And I'm damn sure the platinum was there. Then I considered that it is a very, very defecting remedy. The pathology is at the neurological level, that is more deeper plane. So what she needed is the little bit high potency, but how much high? That was the question in my mind. So instead of going too high and instead of going to too low, I have considered it is better to start with the moderate potency, and I have asked, or I have prescribed her Platina 200, few doses. Ask them to meet me after 15 days. After 15 days, again there was a call that you must come to meet me. So I went over there, but this time she was quite good looking. Her behavior was little bit good this time. So I said, what's the progress? The answer was funny. Answer was that still I'm not able to walk properly. I want to walk very fast, doctor. Is it possible with you? I told that it is not a simple thing to come out of this situation. It will take, you have to go for exercises along with the medicine, and you have to work hard, then it is possible. And she was under the physiotherapy already. So that was going on. She said, it is already going on. So I said, along with that, now we have added the medicine. We'll go ahead with the medicine. My question is that how much do you feel better? She said, I'm not able to walk, that is my problem. Otherwise, I'm good. I said, what about rest of the features? She said, quite good. I'm comfortable. After starting your medicine, I'm comfortable. But basically, I want to walk. This time I have raised the potency. This time I have given 1M. After giving 1M, next follow-up, she was too happy. She said, she called me and first time she asked, shall I come over there in your hospital? I said, why not? Because I was happy. I want to look her actually, how she is walking. And it was good that hospital was not on ground floor, it was on first floor. So question was there in my mind, how she will come. But when she came for on first floor and I saw her, it was interesting and it was good. That was the first platina result and platina prescribed by me in internship period. So it's a very good moment for me because it was the first time I have prescribed such a pathologies at an early phase of life and which worked beautifully. And thereafter, her recovery was fantastic. And with that recovery, she after within span of 6 months, she was recovered so nicely that she called me for dinner in her house one day. So that was the interesting story, and this is what is the platina is there. So we're going to learn it from Alan's keynotes and few aspects of Boericke if time permits. So we'll start with Alan's first, the platina. It is the Platinum Metallicum, adapted to the woman. It is preeminently woman's remedy, what Boericke says. It's very correct. It is adapted to the woman, dark hair, rigid fiber. Their fibers are quite rigid, thin, of a sanguine temperament. Sanguine temperament, they are bloody, they are hot-blooded, their reactions are violent, who suffer from too early and too profuse menses. Many times they have the pathologies related with the uterus, that is more common. DUB is more common with the platinas. They are very commonly suffers from the fibroid uterus or pathologies of uterus. Many times the endometritis also. Sexual organs exceedingly sensitive, that is very important feature. In fact, given in italics, cannot bear the napkin to touch. This sexual excitement, nymphomania is very marked with the platinas. Very much. I've seen one young girl, she came to me, she was a student of engineering, first year, and she said that, doctor, it's very difficult to control me if anyone touches me. And she had a number of time physical relations with her boyfriend. That nymphomania is very characteristic of platina. We'll go into the spasms from examination. Vulva is painfully sensitive during coitus, will faint during or cannot endure coitus. Both things are there. There tremendous sexual excitability is there, and many times that excitability can lead to the spasms also. Cannot do a coitus. That is a very important feature which you can get with this remedy. Two remedies which comes closer. Muriatic acid is in general hypersensitive remedy. Origeron is having very typical sensitivity in the female genital tract. The next feature is very important. The pains increase gradually and decrease gradually. This is characteristic of two remedies, platina and stannum metallicum. Pains are attended with numbness of the parts like chamomile. So pains are attended with numbness. The part becomes numb, heavy. For hysterical patients, at the mental level, hysteria is quite common with platinas. Alternately gay and sad, who cry easily, like crocus, like ignatia, like pulsatilla, but here many times it is deceiving also. Pale, easily fatigued. They are pale ladies, easily fatigued. They are arrogant. The words which are very specific: arrogant, proud, contemptuous, तुच्छ लेखणारे दुसऱ्यांच्या बाबतीत. Haughty. So haughty means they are having pride. They cannot leave their topic. They says that I am correct. Pitiful, looking down upon the people, usually venerated. Venerated means those people who are good people, आदरणीय माणसं म्हणतो आपण, those who are respectful people, to against them also they looks down. A kind of casting them off unwillingly. They cast them away, or they themselves gets cast away. Both the things are present in Platina. Either they feel they cast away certain people, or either they themselves gets cast away from the people. This is the Platina story, in fact. Mental delusions, as if everything about her were small. So that is the rubric, delusion, everything is small. Platina always feels like that. All persons physically and mentally inferior, but she physically large and superior. And this is in fact story of Platina. They themselves consider they are very tall, they are very strong, they are quite superior, and others are inferior. Sensation of growing larger in every direction, that is also one more delusion with them. Tripling things produce profound vexation. So mild things produces tremendous anger. They get angry and their reactions are very strong, like Ignatia, like Stapes agria. But Stapes agria generally keeps it inside. Ignatia weeps, goes into the hysteria. Here it directly shows anger violent. Remains a long time in sulk. If they get disturbed, the face becomes sulky. Sulky means durmuklela chehra. So satiety of life. Satiety म्हणजे वीट येणं, that is in Marathi, satiety. Satiety, weary of life. Then with taciturnity. Taciturn means they talks very less. They never speaks too much. And fear of death, like Econat and Rasig. But here the fear of death is because of their pathologies. That is more common with the Platinas. Mental disturbances after fright, grief, vexation. So fright also produces the mental disturbance. The grief also produces mental disturbance. Vexation, tremendous anger produces the mental disturbance. Onanism, sexual thoughts, dwelling on sexual matter produces mental disturbance. And pride, that is more important, that also produces mental disturbance. Mental symptoms appear as physical symptoms disappear and vice versa. So first type of mental disease or fourth type of mental disease, both comes under the sphere of Platina. That is more characteristic of the Platina. So both first variety as well as fourth variety of mental disease. Headache, numb, heavy feeling in the brain on the vertex from anger, headache from anger, headache from chagrin. Chagrin means again anger which is tremendous. Headache, hysterical, headache from uterine disease. So uterine disease is associated with the headache. Platina is one remedy. So this combination of symptoms one should keep in mind, that headache associated with the uterine troubles, Platina. Headache pain gradually increase and gradually decrease. So it never disappears immediately. Nymphomania, that is excessive sexual excitement. Nymphomania is aggravated in lying in women. Nymphomania, excessive sexual development, especially in virgins. It is caliphos. So this is very important remedy for vaginismus. Yes, next word which he has mentioned, vaginismus. It is spasms of the vagina, spasms and constriction of vagina. And this is very, very sexually excited remedy. Menses too early, too profuse, too long lasting. Dysfunctional uterine bleeding, generally when it is associated with such a personality, first remedy to be think of is Platina. Dark clotted, very offensive, with bearing down spasms, as if something is coming out. That is very typical. Pains in uterus with twitching. Genitals are very sensitive. Excessive itching in uterus, pruritus vulvi. This is again a spasm. This pruritus is because of sexual excitement in Platina. In creosote, the pruritus vulvi is different. That is really a pruritus vulvi in creosote. It is irritation over there, itching over there. Here, this pruritus vulvi is secondary to the sexual excitement. Constipation while traveling, that is very important. Travelers' constipation is very marked over there. Constipation at sea is bryonia. Constipation after lead poisoning. Constipation from inertia of bowel, so bowel movements when restricted producing constipation, paralytic illness. Constipation frequent unsuccessful urging. Constipation where stools adheres to the rectum and anus like soft clay. Like alumina, same future like alumina. Constipation of immigrants. Immigrants means Stalantarit, those who used to change the place. That is traveler's constipation, which is very marked over there. Constipation of pregnancy. Obstinate cases after nux has failed. So obstinate cases of constipation after nux has failed, this is very important remedy, one should not forget. Metrorrhagia. So metrorrhagia, intermittent menses, flow in black clots and fluids, thick black tarry or grumous mass. Grumous means it is as if clots, guttary circle, strong, like crocus sativus. So very important remedy in dysfunctional uterine bleeding, DUB, metrorrhagia and menorrhagia. This is one of the important remedy. Relations compare aurum, the crocus, the ignatia, caliphos, pulsatilla, sepia, stannum, and valeriana. Valeriana, the vegetable analog. So valeriana is the remedy where the hysteria is very marked over there. Aurum, the close metal to the platina, having high atomic weight and producing similar syphilitic pathology. Crocus, the bleeding which is very close to it, that's why crocus is one more important remedy close to it. Ignatia, again for hysterical spasms, the weeping tendencies. The caliphos, like mental symptoms which are very common over there. The pulsatilla sepia, both remedies for the DUB as well as for the emotional states which are there, weeping tendency. And lastly, the stannum metallicum. Stannum is a very important remedy where pains increases gradually and decreases gradually. So this is Platina from the Alinsky notes. Only first paragraph of Boericke's Materia Medica is few features. In fact, not too much, only one or two features which I want to highlight over there because they are important related with the Platina. So open the Boericke also. I will tell you some features. Platina, the metal from Boericke's Materia Medica, preeminently a woman's remedy. That is the first sentence in Boericke, and this is true. Second, strong tendency to paralysis, anesthesia, localized numbness, and coldness are shown. So, paralysis tendency, nerve affections, the paresis, the numbness, coldness, these are very, very, very important features of the platina. Hysterical spasms, that's already we have discussed. The pains increases gradually, decreases gradually. Sternum, very important feature of it. And last is tremulousness. This is again a good remedy for trembling, tremors. Senile peoples, the tremors are there. Those who walk shows the typical features of the Parkinsonisms. This remedy plays very vital role in such types of cases. So pathology which happens to be there with such a lady, generally arrogant, contemptuous, pride, superior. In such cases, this is a wonderful remedy to be think of. So Platina, one must read it again from Boericke's Materia Medica, the whole story, so that you will grasp it more accurately regarding the platina, and you will be very easily prescribed, and even in exams you can write down about the platina. So that's all for today. Tomorrow again we'll meet with some other remedy and third year's remedy, and we'll continue. So thank you being there, and good night.